In the midst of a global obesity epidemic, eating disorders are another major public health concern. Eating disorders are not only extremely prevalent but also on the rise. Research from Deloitte Access Economics estimates that 28.8 million Americans will have an eating disorder in their lifetime, with 1 in 7 males and 1 in 5 females developing an eating disorder by the age of 40. The American Journal of Critical Nutrition has also reported that the prevalence of eating disorders increased from 3.5% to 7.8% between 2000 and 2018. This means that cases of disordered eating more than doubled in less than 20 years' time. So what are the factors leading to this major increase in the prevalence of eating disorders? To start, lack of nutritional knowledge is a major issue. Many people rely on the scale and utilize BMI when that is not a sufficient measurement of health. A lack of knowledge on proper nutrition and macronutrient recommendations causes many people to follow poor diets and can increase the potential for the development of dangerous eating habits. Media is also a major driver in the rise of disordered eating. Pew Research Center estimates that 9 in 10 American adults use the internet, and approximately 72% of them use at least one social media site. With this heavy use, people are constantly exposed to endless images, videos, and information. Both men and women can feel pressured to achieve a certain physique based on images portrayed in the media. Photo editing tools such as Photoshop are widely used in advertisements and in social media content, making the bodies portrayed physically unattainable. According to the Dove Global Beauty and Confidence Report, 7 in 10 women report a decline in body confidence driven by the pressure for perfection from the media and unrealistic standards of beauty displayed in advertisements. These unrealistic standards set in the media may encourage individuals to research harmful diet or weight loss products that can have dangerous effects on health in the long term. The rise of nutrition and fitness tracking technology may also be contributing to the rise in eating disorders. While many of these applications have the potential to help individuals reach specific health-related goals, they can also potentially trigger, maintain, or worsen disordered eating symptoms. Nutrition education is an effective way to help prevent the risk of adopting an eating disorder, but it is not a foolproof method. Many people can see long-term benefits by developing healthy habits based on learnings in nutrition education programs, but programs too focused on the risks of obesity could lead an individual to adopt harmful eating habits or orthorexia in an effort to avoid a fate of obesity in the future. As future nutrition educators, how can we work to reduce the prevalence of eating disorders? We must recognize that while many nutrition practices are universally accepted and taught, nutrition is not a one-size-fits-all science. By accounting for the many risk factors of eating disorders, nutrition educators can develop more effective programs tailored to the needs of their students that utilize inclusive, science-backed messaging and recognize the impact of social pressures on daily life. Nutrition educators should also look beyond nutrition-specific guidance and provide additional strategies such as media literacy skills training, inclusivity training, and mental health support to further reduce the prevalence of eating disorders.